All right, everyone, we will transition into our next session. This is one of my favorite sessions and I'm very excited to hear from Ms. Shavonia Wynn. She's the director of Johns Hopkins Underrepresented in Medical Professions at Johns Hopkins University. Ms. Wynn worked as a learning specialist for post-bac pre-med students and medical students, and also worked closely with the admissions office to deliver MCAT workshops, consult on medical student data, serve as a medical school multiple mini interviewer, and sit on the post-bac pre-med admission selection committee. She's a wonderful speaker, and I have the great honor of welcoming Ms. Shavonia Wynn as she discusses the topic, how to become a competitive MD applicant. I will go ahead and stop sharing my screen. Thank you so much for joining us today, Ms. Wynn.
Hi, can you guys hear me?
Yes, I can hear you.
Okay, great. Let me share my screen. So thank you so much for that introduction, Alexia, and thank you to all of the members of the National Pre-Health Conference Committee for allowing me to speak today. I'm very excited about that. So let me go ahead and share my screen.
Wonderful.
Okay, can you guys see it?
Yes, we can.
See my screen? Okay, perfect. Okay, so my presentations are always pretty interactive. So I'm gonna ask everyone who's listening to this presentation to go to joinpd.com. We're gonna use Pear Deck for our presentation. And also if you're on the YouTube channel, go ahead and go to joinpd.com. When you get to joinpd, it's gonna ask you to put in this code. The code is KPIMT. Go ahead and do that now. Now wait till we get a few students on here. All right, 44. I want a few more students. So joinpd.com if you're on the Zoom call, or if you're on YouTube, you can participate. Okay, I will go ahead and get started, but the code is still right up here in the upper right-hand corner. If you're just joining, you can still go to joinpd.com and type in the code. So as Alexia said, I am Shavonia Wynn, and I'm going to talk to you guys today about how to become a competitive MD applicant. I did spend 8 years at the University of Arizona College of Medicine, Phoenix. And like Alexia said, I worked with medical students for 8 years. I also worked pretty close to the admissions office. So when I was thinking about putting my presentation together, and I was like, you know, I don't want to do just the traditional things that you can read about or you can Google about how to become a competitive medical school applicant. I wanted to take it from a lens of some of the hidden curriculum besides inside becoming a competitive medical school applicant, and leave you guys with some things today that you might have not have necessarily thought about when creating your application. And maybe some things to think about lens that people read your application with, okay? And I hope I say some things today that will help you, okay? Because I am I'm such an educator, I like to walk away with like takeaways. Okay, I'm going to give you 5 takeaways today of how you can become a more competitive MD applicant. You can see they're redacted right now because they're top secret, and we're going to reveal them as we go along. So hopefully one of these will be something that you hadn't really thought about and you're looking to put into your presentation. I mean, you're looking to put into your application. Okay, so the first thing, we're going to start with tip 1, okay? And sometimes I'll reveal the tip, or sometimes we'll do a little activity and then I'll reveal the tip, okay? So we're going to do a little activity first. The first question it's going to ask you, which characteristic, and it's a multiple choice question, do admissions committees value the most? So do you think they value readiness the most? Do you think they value willingness the most? Or do you think they value ability the most? Okay, so I'm going to wait till we get some of these locked in. Before I reveal it, got about 75 so far, and we'll look and see what's the correct answer. All right, let's take a look at the responses. Okay, so about 7 of you said a readiness for medical school. 20 people said a willingness to learn. 8 said the ability to handle the academic rigor. And 64 of you said all of the above. Okay, and some of those are still coming in. So the correct answer is D, all of the above. So kudos for those of you who got that. But we're going to talk about like what do these mean and how can you actually display this within your application. Okay, so my first tip is you have to show that you are ready, that you're willing, and that you're able. Okay, very, very important to display to medical committee, to the admissions committees. So what does readiness mean? Like, what does that actually mean? It means that you have to show committees that you're ready to make a mature commitment to medicine. It can't just be a commitment. It has to be a mature commitment to medicine, right? And so you might say, well, Shavonna, how do I show that I'm mature enough to, I'm ready to handle this and I'm mature enough to handle this? And the way that you do that is by showing you have diverse life experiences, right? So even though many of you are, 23, 24, 22, 25, you can still have really rich life experiences that lets admissions committees know that you're ready for medicine, okay? Also displaying it through the, so I'm going to show you guys the EAM model, and I'll also show you the double AMC core competency models. Let's take a look at that right now and see how, let's get some ideas about how we can show admissions committees that we're ready, okay? So on the left-hand side of the screen, you see the experience, attributes, and metrics models that a lot of medical schools use to evaluate candidates using a holistic approach, right? So you see here on the outer circles, we see where we have experiences, right? So what are some of your life experiences? Where have you traveled? What kind of leadership roles? What kind of healthcare experiences? What types of community service? What have you done within these experiences, okay? The attributes say, who are you and how did some of your experiences shape who you are today and where you see yourself going, right? And being able to articulate that is how medical admissions committees can see, wow, this person is ready for medicine, right? Also, if you look on the right-hand side, these are the AAMC 15 core competencies. And these core competencies also tell medical schools, wow, this person has really paid attention to what we're looking for. And they displayed maturity in a lot of these areas, right? So they displayed a lot of maturity within their oral communication, within their written communication, with their critical thinking, with their resiliency and adaptability, with their reliability and dependability. So sometimes people might say, well, Shavonna, I don't want to just tell them I'm reliable and dependent. Like, how would I show that? And I'm like, you can show that by a job that you might have held for a long period of time. That shows that you were reliable and dependent to hold down a job, service orientation, different things you do, an ethical responsibility to self and others. Maybe you can talk about a different situation that you ran into where you had to display some of that. Teamwork, cultural competence. Not asking you to say, hey, I took a workshop on cultural competence, but if you are really looking for diverse and meaningful experiences, they should have a lot of these things already built in, and it's up to you to properly articulate that to the admissions committee, okay? And like I said, it has to be done in a mature enough way where the reader is not having to guess. Like you were supposed to do the work for me, right? So sometimes I'd be reading applications and I'm flipping and turning back and forth. And if you're making me work too hard to figure out, is this person mature and ready? You have not done your job properly, okay? And you've made my job really hard to try to figure out if you're ready to handle medical school, okay? Willingness. So being ready and being willing is two completely different things, right? So you have to show that you have a willingness to learn, which means you're teachable and adaptable. Um, you have to show that you're willing to become a doctor. So you might say, well, Shavana, of course I'm willing to become a doctor. I'm submitting an application. And I'm like, no, 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 no. Some applications, we can read it and tell that the person wants to be a doctor. Now that's different. If someone came up to me today and said, hey, Shavana, do you want to be a doctor? I'm like, sure, give me a stethoscope, give me a white coat, give me, $200,000 a year, I'll be a doctor, right? But if someone's like, do you want to become a doctor? I'm going to say, no, I really actually don't want to become a doctor. I am not interested enough in that portion of medicine to want to get involved with the patient care and want to be taught all the stuff that I need to be taught. So you have to show that you're willing to become a doctor. There was a football coach that once said, the goal is not the Super Bowl, the goal is a Super Bowl ring. Okay, so while a lot of medical pre-meds, they write their application with the goal being the Super Bowl, but they're reading your application with the goal being the Super Bowl ring. So they have to see that you have a willingness to be taught and be molded, and you have a capacity for improvement for all 4 years of your training throughout medical school. Okay, so that's how sometimes there's a disconnect between how you're writing it and how it's coming off through your application. Okay. Then you have to show that you have the ability, right? And this is the one where students usually, it's kind of a go-to for them because their metrics are together, right? Because of course they're going to look at your GPA, your science GPA, and your MCAS score, right? So you want to make sure that you're showing you have the ability to handle the rigor of medical school. And are there any sore spots, right? So what happened and what do you plan to do differently in the future? I always get a little nervous when I clearly see you have sore spots in your application, but you didn't tell me about them or what happened. So guess what? I'm just going to make something up in my mind. And I'm like, oh, maybe they just, I don't know, gave up in organic chemistry, right? And if your grade is a little bit lower, but you tell me, you know what? I figured out that office hours were the key and tutoring was the key. And I started going a little bit later, but I hung in there. I went to tutoring every day. I started going to office hours. I brought my grade up. And now I learned from that experience that it's better to ask for help earlier than waiting, to see what's going to happen. So you can change it. But sometimes there are sore spots in your applications, but you just have to address them. So I did a little visual for you because sometimes when people read your application, they can tell that you're ready and willing, but you might not be able just yet. Or you're ready and able, but you might not be willing, right? Or you're willing and able, but you might not be ready. So you really have to show that you're ready, willing, and able, okay? All right, tip number 2. So tip number 2 is, have you smelled medicine? So some of you might have heard this phrase before, that admissions committees want to know if you've smelled medicine. And what that means is you have to make a complete stranger. So I don't know you from a hole in the wall, but when I'm reading your application, you have to make me feel comfortable that you understand the good, bad, and the ugly of what you're about to get into, right? The biggest reason for that is medical schools do not want to admit students who might change their minds, right? It is a huge investment, right? And I know you guys are making a huge investment with your time to get into medical school, but admissions committees, from the first date they open until all the way through their revisit days and all that, right? It is a humongous investment to admit students. And they don't want to admit a student, and then you get, halfway into your first semester and you're like, actually, I kind of think I just want to be a dentist, or, not just, actually, I think I want to be a dentist, right? Or I think I want to be a nurse, or I think I want to be a PA, like, which are all great things and are all needed, but you took a spot from someone else that often has to go unfilled because medical school classes are only once a year. So there's a reason why medical schools have um, really high graduation rates, like 99 and 100%, because the selectivity is so that they're selecting students who want to be MDs and want to graduate with an MD, okay? And you show that through diverse and meaningful experiences that you've smelled medicine, like you really understand what you're getting into. Now, of course, COVID has thrown a huge monkey wrench into a lot of this for some students. But admissions committees are still going to want to know, what did you do to smell medicine before COVID happened, right? So, and this doesn't apply if you just decided your senior year, hey, I want to pursue medicine. But if they're looking at an application where you've been doing stuff and on a pre-med type of a track since, your freshman year, they're going to be curious of like, why weren't you doing clinical experiences a couple years ago, right? So, and if you haven't done that, like it's okay, but now what are you doing during COVID to try to get some additional smells in of medicine, right? And it might not be in patient care, but maybe you can say, hey, I reached out and did some telehealth shadowing appointments, right? And of course, like I wasn't in there exactly with the patient and I wasn't, right there in the, in the room, but I did learn some important lessons about telehealth during COVID. And now I see where there's opportunities. I see where some good things came out of it. I see where there's some opportunities for growth. And you can really play up what kind of COVID experiences you had during this time as well. Okay. What important lessons did you learn during this time? They're going to want to know that too. The other thing I'll say is that, this is an important lesson for high schoolers who are on this call, for freshmen, for sophomores, for juniors who are thinking about taking a gap year. Plan your clinical experiences ahead, right? Do not wait until the last minute because there's no guarantee. Like we couldn't have foreseen what was going to happen with COVID. So there's no guarantee that when the time comes, like when you have the perfect opportunity to do your clinical experiences, that it's going to be available to you. So spreading out diverse and meaningful experiences all along the way can really be helpful and help you maybe not get into situations where then you're getting ready to apply and you haven't really smelled medicine. Okay. Tip number 3. Okay. So tip number 3. So what I want you to do before I reveal tip number 3, I want you to go ahead and drag the little star that you see on your screen. And I want you to drag it to what area you're most interested in. Okay. So you can see conventional medicine is like right down the middle. To the right is more research. To the left is more public health and working with like social determinants of health and that sort of thing. But I just want you to drag where you're most interested. Now, I completely realize that all of these areas do overlap at some point, but for the sake of this presentation, we're going to kind of look at them a little individually right now, right? So this is a sliding scale, so you might end up a little bit more in the middle here or a little bit more over here. So just put wherever you feel like your interest most lies. All right, let's see what we got here. Oh, this is good. Okay, I see people still kind of moving their stars around a little bit. Okay, nice. Okay, so this is really, really important to think about before you submit your application, to try to think about, for someone who doesn't know me, if they read my application, what are they going to think that I'm interested in actually doing? Okay. I have read students' applications where it didn't mention patient care at all. Nothing. There was nothing about wanting to treat patients, and trying to get students to realize a lot of what you're going to do in conventional medicine or allopathic medicine at the end of the day is treating patients. I think we heard from Dr. Brass earlier, and it was really interesting what he said about, when you graduate with an MD, PhD, there's certain fields that they want you to kind of go towards. The same thing with, graduating as an MD. Now, you can, of course, once you get your MD, there's a lot of other things you can do. However, when the admissions committee is reading your application, if all you talk about is public health, that's it. All you talk about is public health. The person reading your application might go, you know what? I don't know if we're going to be able to provide a fulfilling experience for this person if that's really all that they want to do, right? Because you could get an MPH and do that now, right? You wouldn't have to necessarily go through, the 7 years of schooling or the 8 years of schooling. Same thing with research. I've read MD applications that were so heavy research, and I'm like, wow, does this person need to get a PhD instead of, being involved in so much patient care? So they are looking for people who are interested at the end of the day with working with patients and treating patients, especially because there's a lot of clinicians who often sit on the admissions committees, and they're going to be like, wow, does this person actually want to work with patients? Okay, so let's look at, so my third tip is you want to make sure your application actually states and it's actually coming across that you're interested, number one, in conventional medicine, and you have a realistic view of conventional medicine as well, okay? So in terms of realistic view, read so many applications when people said, I want to change the world. And I'm like, I don't actually know what that means, okay? There's so many different ways to change the world, and you don't have to be an MD to change the world, right? Or to say, I want to help people. And I'm like, well, anyone can help people, right? That's not something necessarily that you need to go to 7 years of schooling to do. You don't necessarily need to be an MD to do that. And that's very, very broad, right? Or talking about that you want to cure people, right? And especially clinicians, when they read that in your application, or you have this very unrealistic view of conventional medicine, they might be wondering if, when you get a bit into school, into your MD schooling, when you get into residency, are you going to be happy and fulfilled with what the job actually is? Okay. So if you want to talk about how you're going to help people, you have to apply meaning to it. Okay. And you want to do that by trying to be specific in some instances, right? And a lot of students will talk about, well, I want to give, I want to help underserved communities. I want to work with people who don't have access to medicine, but then nothing in their application, I see nothing there that says they've ever worked in an underserved community, they've done anything for underserved communities. So I'm like, well, you're interested in doing something that you don't know anything about, right? And sometimes students will even say it if they have a background, right? Like, I come from an underserved community, I want to work in an underserved community. And I'm like, that's great, but you want to do what? Like, what do you actually want to do to maybe help and improve the situation? And this goes back to, you want to show you're mature enough to actually say, what can I actually do? Because you're only going to be able to do so much, right? And I'm not trying to say this in a negative way. I'm trying to say you don't want the admissions committee to feel like you're going to be disappointed once you get in and start doing this, right? So apply meaning, but also if you're going to talk about it, you need to be about it, right? Because if not, it comes across as you're making it trying to sound good, but it might not be things that you've actually been involved in, right? Again, if your application just talks about research, and I'm not talking about MD, PhD applications, I'm strictly talking about MD applications, same thing. It's like, oh, do you actually want to like be around sick people? Same thing with public health, or public policy and things like that are all great. But at the end of the day, are you truly interested in being bedside? Okay, so another thing to just think about and consider. Tip number 4. All right. So tip number 4 is I, Robot. Okay. So many of you have probably seen this movie, I, Robot, but let's talk about what this means. Okay. Medical schools do not want to admit robots. Okay. They do not want to admit people who they think are just going to study all the time. Okay. Why is that? Number one, when they are doing a holistic review of your application, they have to be able to see that you are a well-rounded, mature person that has had multiple life experiences that cross multiple different areas, right? Medical schools are investing in you. You know how you are going to be investing in this career path because you're going to be making a lot of sacrifices. You're going to be making personal sacrifices, family sacrifices, like you're going to be giving up a lot to then gain a lot and give back to the community. That's how medical schools view this as well. If we select you for our medical school, we're investing in you. We're saying that you're innovative, you're creative, you're energetic, you're unique, you're friendly, you're compassionate. We want to admit students who will leave the community, right? So when I say community, wherever you go to medical school, a lot of times there will be in an area where they serve the community, right? So they want to admit students who will leave the community and the school, and the medical school in a better condition than how you found it. And I want you to really think about that for a second, right? Um, so this doesn't have to be, oh, well, I won, a $3 million grant for my school. I'm not talking about that. I'm talking about they want to admit the student who maybe, you know, has the vision and it's displayed in your application that you have a vision. So I think about one of my previous students at the University of Arizona. And one of the things that, made us want to invest in her was she said, hey, I was shadowing a doctor and I noticed that a lot of people bring their children in. It was a community clinic. A lot of people bring their children in and then their children are bored sitting in the waiting room. So I got people together at my undergrad institution. We did a book drive and then we put the books in the waiting room so that the children have books to read while their parents are being seen by the physician, right? So this is a person that I'm reading their application. I'm like, wow, this person would potentially leave our school and leave the medical community where we're at in a better condition than how they found it, right? So they like leadership, they like innovation, they like people who look for solutions for things. And it doesn't have to be, like I said, over the top, but it's things that you cared enough and you took enough initiative, right, to do that. So schools get very excited when they see stuff like that. And it also shows that you're passionate about things and that you're able to execute things that you're passionate about, right? So mentioning, of course, when you're volunteering and your community participation, I put a little asterisk because your volunteering and community participation has to be genuine. We can always tell when it's not genuine, right? Because when it's not genuine, it's like, oh, I did this for 4 hours. I'm like, okay, all righty. And if that's the only thing that you had, that you were trying to show that you had community and community service and volunteerism, that does not show me that you were taking leadership and initiative, for those things to be able to leave your community possibly in a better condition than how you found it. Showing your hobbies and passions are great. And of course, exercise and health related activities are always great because medical schools want to admit well people, okay? They want to admit people who they know when the going gets tough, that you're going to have a healthy outlet in medical school, and you have healthy outlets before you come, and those healthy outlets will be continued on into medical school, okay? So I want to know from you guys, what are some of those enjoyable activities that you plan to list on your application outside of medicine? This can be community service things you've done where you were really passionate about it and you enjoyed it, hobbies or your individual interests. Just go ahead and write your response using Pear Deck, and we'll scroll through and see what are some of, who do we have in here and what are some of those enjoyable experiences that will make admissions committees excited about who they're getting ready to admit, right? You might say, oh, I'm really interested in doing yoga. And they're like, man, this person might come here and start a community yoga program, right? So let's take a look at some of these in a second. All right, let's see what we got here. Hiking, reading, cooking, jump roping. That's awesome. You don't really see a lot of people jump roping. That's really cool. Great exercise. Animal shelter volunteer. That's great. Awesome. Shows a lot of compassion. Community service, working at a sexual assault center and health center on your campus. Music is also really popular. Running. Making YouTube videos. I love it. Especially, there's a lot of students that will make YouTube videos to help other people. Great. Dance choreography. Running right after taking a stressful test. Excellent. That will definitely come in handy when you get into medical school. Catechism teaching, crisis text line, beach volleyball club. I love it. Taking initiative. Great job. Volunteering at Give Kids the World. Nice. Feed my starving children, drawing and painting. Indian classical dance, singing, playing the flute, painting and running. Local hospital. Ooh, someone's here from Arizona. Hey. I love it. Mentoring students. Yep. And this is important. Anytime you can tie in cultural competency to some of the things you've done, or remember we talked about those AAMC core competencies, a lot of this stuff that you've written here will capture that, right? We talk about overseas community service, that's teamwork, right? I love it. Medical vlogs, long distance running, baking and donating goods to homeless shelters, writing fictional stories, learning languages, tennis. I love it. A lot of musicians. A lot of baking in here. Educating those that have diseases that need to eat certain foods. Awesome. Guiding low-income students through the college application process. Love it. Ooh, beach cleanup. I love it. Bridal embroidery. Nice. Volunteering with puppies, commitment to community service. Yeah. All of these things you can turn into, like I said, individual interests that you have healthy outlets, and also binge watching shows on Netflix. I feel you. That's my release sometimes as well too. Captain the Dance Team. These are all really great ideas, you guys. I love this. Thank you for participating in this. One thing I will mention is you don't want to say anything that is dangerous or shows that you're not mature. Believe it or not, I read a post from someone, or I read in someone's application for their hobbies. They said they ghost ride cars, and I'm like, not too bright because you might get run over, right? Do not list things that are perceived as not making good decisions in your medical school application, right? I love it. These are great, guys. Okay. All great things to be thinking about. Now, if you're, let's say you're high school or freshman, sophomore, you're like, I really don't know what I'm interested in. That's part of being worldly and having diverse, meaningful experiences. You need to start just reaching out and trying different things and seeing what it is that you like. And that will really help you to try to develop some of that by the time you get ready to apply. Great. All right, our last tip before I move on to Q&A. Okay, so here's our last poll question. What group is the most influential during the medical school admissions process? What group do you think? So I listed a bunch of groups there. Let's see what you guys say. All right, let's take a look at these. All right. All right, so no one said the Dean of Admissions. 20 people said the admissions committee. 3 people said current medical students. No one said student alumni. 8, the interview committee, 5 said the admission staff, and 53 said all of the above. Okay, so if you picked G, you are correct, all of the above. So I want to talk about this a little bit too, because I think sometimes students don't realize how the admissions process works. Like we hear a lot about like the admissions committee, and it's kind of a catch-all word. And it's like, a lot of times you would never even know who's on the admissions committee unless someone says, hey, I'm on the admissions committee for such and such school. Even if you know one person, a lot of times the admissions committees are so complex with how they work. Not one person is making decisions for things, right? So let's talk about this because the last tip I'm going to leave you with is, in order to be a competitive MD applicant, you have to realize every single interaction you have with every school that you're talking to or emailing is part of the interview process, okay? I would get so shocked. I'm going to tell you guys a quick story. When I was working at the University of Arizona, I was walking by the admin's desk, and I just happened, the phone was ringing, and I happened to pick it up. And we were hosting an informational session, and the student said, hey, I want to come to the informational session. I had a couple questions, and I answered his questions. And he said, I said, oh, it's on Saturday. Here's the time. Here's, and he said, well, that's great. He said, but is anyone important going to be there? And I said, well, let me tell you about important people, okay? So every single person, okay, in this entire building is important. Number one, you don't know who's on the admissions committee. Number two, you don't know who anyone in this building knows, okay? And number three, a lot of times being unprofessional, or I'll even go as far as maybe saying being rude, it can get back to people on the admissions committee or people who are involved with admissions, right? So trying to get that students to see that before you have your interview, right? So if you call, which sometimes happens, let's say you call to check on your application or what's going on, and you're kind of frustrated and you're losing patience and you're a bit rude to the person answering the phone, that can impact you from being a competitive applicant, right? You would think, well, these people get thousands of applications. They couldn't possibly remember me. And I'm like, oh no, they remember you. They will remember you, right? So you need to make sure before your interview, when you're emailing, when you're calling, that you're respectful, you're patient, and you're trying to be understanding. We're all, I mean, it's different. It's difficult for the admissions teams in general, but even with COVID now, it's increasingly difficult. So just be aware that even before every interaction you have is part of the interview. During the interview is also really important, and not just answering the questions, but all the things that happen in between. So I know at the U of A, they used to do like a mixer the night before. They might still do that when you guys are on Zoom. They might say, hey, you can meet some of the current medical students and talk to them. That's part of the interview. That's part of the interview, guys. Let's say I observed a student once fall asleep during one of the presentations during their interview day. And I'm like, you fell asleep. I'm like, this is your best foot forward. This is like the best. Like, they're going to notice stuff like that and pick up on it. Zoom might offer a little, I think it'll be a little bit easier for that because, there'll be some breaks built in. But remember, we won't be on Zoom forever for interviews. And so just depending on what happened with that, just remember the entire day. And then after the interview also matters. So if you call to check on something, make sure you're still respectful and understanding and patient. Make sure that you follow up and say thank you, and that every interaction you have is just very, very respectful, because every interaction is part of the interview. Okay, so here's my synopsis. My 5 tips again for everybody. And here are just some of my quick references. And then I will take any questions that you guys have. Thank you so much for allowing me to speak. And I hope I said some things that were helpful on your journey to become a competitive MD applicant.
Thank you so much, Ms. Wynn, for this amazing presentation. I know for me personally, I learned a lot in your presentation, wrote down so many notes. My entire page is covered, and I will take this advice well into my application and medical career. So thank you.
Good, thanks.
We have several questions from the audience, and I will go ahead and get started with the first one. Where can we find telehealth shadowing opportunities? I know you mentioned that, like what ways can we get involved with that?
Yeah, absolutely. So I think the best way right now, it's kind of similar to what you would have done to find shadowing opportunities. So reach out to family physicians, or just even asking around at different physicians' offices. I know a lot of people share opportunities on social media, talking to your pre-health advisor or going to your health advisor's office, because a lot of times um, they're gathering all of that information and making it available to students. I think there's going to be a lot more telehealth. I think there's a lot more opportunities to observe telehealth appointments. I just spoke to a doctor today that was like, yeah, we'll let anyone observe a telehealth appointment as long as it's okay with, with the person. So I think you have to just cast a wide net for it. And remember, telehealth is really cool because you don't have to necessarily be in the same state. You're not location bound, right? So even if some of the physicians in your area aren't doing it, I don't know, maybe call physicians in a neighboring state, or, you can really get creative. So with that, so yeah, I would just Google social media, talking to different doctors.
Absolutely. Next question. Can you provide examples of willingness and readiness in an application?
Yeah, absolutely. So willingness, yeah, let me talk about willingness first, right? So willingness to learn, and I'll tell you guys, I have been in the admissions committees with other MDs, and they read an application and they're like, I don't think we have anything to teach this person. This person seems to think they know more than me about being a doctor, right? You can't have an air of arrogance to your application, right? You have to say, hey, I had this really cool experience and this is what I learned, but I know there's so much more to this and so much more I'm going to learn in medical school, right? You want to have a thirst for knowledge and say, talk about how hungry you are for different experiences. You can also show willingness for the why medicine portion, or why this school, or why medicine, right? Why this school, you can take a look and say, wow, I saw your school has, this really great service and community program. I cannot wait to work within that program. It's a passion of mine. And I can't wait to really learn what are some of the things, and I'll use Baltimore for an example, but what are some of the areas where I can make an impact in the Baltimore community, and I can't wait to get in and just learn and soak up, everything I can about that. So that's one way you can show willingness. You have to make sure that there's still things that you can still be taught, right? So to read an application where it says, well, as a doctor, it's like, well, you're not a doctor yet, and you really don't know about that, right? So you have to be careful about that. And then they wanted to know about readiness. Yeah, readiness is part of the maturity, right? So you really have to show that you have had enough experiences in life where sometimes I'll read someone's application and I'm like, I think they would do this for free. I think if money was not involved in being a doctor and the title was not there, I still think this person would want to do this. That's how ready they are to do this. So you have to make sure that it comes across to a complete stranger like that.
Absolutely. Wonderful.
Mhm.
Our next question is from the chat. What are some ways that you have seen applicants spend their gap years? Any that stood out to you?
Yeah, absolutely. So I think the best gap years are spent filling holes in your application, right? So let's say you're missing out on like clinical experiences. Um, you don't want to say, well, I spent all my time tutoring high school students, right? That was great for like community work, but what did it do to actually fill your gap, right? The way to know if you have gaps though is to be self-aware, right? And sometimes that's hard because we think we've done sometimes a really good job in areas, and sometimes it stings a little bit when people are like, oh, that's not very good. So you have to, number one, say, what are my gaps? That's what I need to do, right? It might be a little bit easier if I talk about ways that you shouldn't spend your gap year, right? So if you know you have an MCAT gap, okay, doing a whole bunch more clinical work and community service work and piling it on while you're trying to retake the MCAT is a horrible way to spend your gap year. If you have to work, that's one thing, but then saying, okay, well, I'm going to spend, another 3 hours a day working, shadowing a doctor, you're not offsetting the gap in your what could be in your application. So to have a really meaningful gap year, you want to look over your application and say, where are the gaps? And sometimes those gaps might be, I didn't get enough time to like really write a great personal statement. I didn't get enough time to spend on my secondaries. I was swamped. So that's what you really want to spend your time doing. And then don't pile a whole bunch of stuff on top of it. Because you really want to show I was committed to filling this gap. I filled it, and I'm so glad I did. And here's what I learned from it.
Wonderful.
So really pare it down. Do not pile a whole bunch of stuff on where you're like traveling to Africa and you're retaking the MCAT and you're working to pay your bills and you're shadowing a doctor. It's just a bad idea. You're going to end up doing a half job at all of them.
Definitely. That helps a lot. I'm interested in the gap here, so I've definitely received advice with.
Absolutely.
All right, next question. What's a common piece of advice given to pre-med students applying to med school that you think is inaccurate?
Oh, that's a good one. I read a lot of inaccuracies. You know what I think the biggest one is though? First, well, kind of two, letting everyone read your personal statement. I think by the time it gets done, it really gets watered down a lot and your own voice gets really lost in it. Sometimes the best thing is to have a few strangers read it. Like it's great if your friends read it, but they know you. So it's hard to see sometimes the flaws in when we have close relationships with people, right? And I'm just saying flaws because a lot of times that's what people want to know. But you need to have a couple strangers read it to go, just like I said, when I was like, is this person even interested in patient care? Like it doesn't even say that, right? And have questions that you ask them of like, hey, does it seem like I'm interested in patient care? Like, do these things come across? So that's a good thing I would do. The other thing is spending too much time trying to figure out what admissions committees want to hear or cliche things. They've seen it all. They're not interested. And honestly, it comes across as like so disingenuous and we can kind of see right through it. Be yourself. Be yourself. Like it's always gonna work out better in the end. And then just some of the standard myths. I think Dr. Parker talked about one that you have to be a science major. No one is going to care that much about that, right? I mean, they'll look at your science GPA, but if you want to major in English, that's fine. So yeah, I think those are some of the myths.
Awesome. Next question. Would my shadowing experiences count as being exposed to smelling medicine? What are some experiences that could prove that I've been exposed to smelling medicine?
Yeah. So definitely direct patient care, right? So they have to see. So number one, they're going to want to see two things. Do you actually understand how a doctor spends their day, right? Because it's not all going to be, oh, everyone get to the trauma bay. We got a 5-car, accident coming in with trauma victims. And it's also not Grey's Anatomy, right? Sometimes you do paperwork and sometimes you stay up all night. There's less glamorous parts of it. So sometimes they want to see, have you just seen some of that? Like, have you seen the glamorous and the less glamorous parts of it? And then two, have you actually interacted with sick people from the public, right? Because sick people are not always the happiest people, right? I know when I go to the doctor, I'm like in the worst mood ever, right? Because I don't feel good, right? Have you interacted with patients that are sometimes grumpy and not feeling well, and they want answers and they want to know why you haven't cured them? And did you like it? Did you enjoy it? Because sometimes people work with patients and they're like, I didn't actually really like that as much as I thought I was going to, right? So you have to be able to do enough. You have to be able to do enough where whoever's reading your application said, okay, they understand how a physician spends their time and they've interacted with sick people enough where you really understand what you're in for with this, right? And then maybe you just decide you want to be an anesthesiologist and they just are asleep the whole time. But still, you have to do a lot of stuff before you get there. So you want to make sure it's deep enough. It doesn't mean that takes 100 hours, but the experience needs to be meaningful enough where you can talk about it. Because if you just, you know, if you didn't really do anything while you were there, or while you were shadowing the doctor, or while you were having the clinical experience and you can't really talk about it, it probably wasn't meaningful enough.
Absolutely. Awesome answer. Thank you so much. I have a couple more questions regarding research that I will just compile into one.
Okay.
How important is having a research experience for your application and for preparing to medical school? And to add to that, or was it? Is it bad to have little or no research experience?
Okay. So let me answer that question by, it truly depends on the medical school you're applying to. If you want to apply to a research heavy institution, I'll just use like Hopkins as an example. They're going to look for research. Like, not all medical schools have that as a forefront or have that as like an integral part of their curriculum though. But if you're applying to a research heavy institution or like an R1 institution, they're going to be looking for that, right? Because it's important and they want to make sure they're admitting students who are going to move research forward, right? That doesn't mean you have to be published, but they just want to know that you're interested in it. I do think most medical schools do have components built in of research. So they're going to want to see something. That doesn't mean you have to be published. I mean, if you're going to a heavy research institution, they might be looking for some more of that. But I do think they want to know that you have some basic level of skills, you've been exposed to research, you've done some things, you're interested in it. I would certainly make it a point to get something in before you apply. Okay. But like I said, if you're going to be going to like a research heavy institution, they're probably going to want to see more rigorous research experiences that you have because that aligns with what their mission is. So you have to kind of know where you're applying to. Just like if you go to an institution that's really heavy on community service and you apply and you have no community service, they're going to be like, well, you might be miserable here because this is this is what we do here, right? Yeah. So I hope that helped as a.
Yes, absolutely. I'm going to ask one more question.
Okay.
With your experience as a multiple mini interviewer, can you provide the types of questions that interviewers may ask? And could you also briefly describe what a multiple mini interview is?
Yeah, so a multiple mini interview is where instead of having a one-on-one interview or a panel interview, you see about 10 to 12 people for 7 minutes each, okay? So usually you'll have 2 minutes before you see the interviewer to read the prompt, and then you walk in the room and you have 7 minutes to discuss the prompt. So it can be ethical situation, it could be a scenario. They can have a standardized patient in there where you have to act out a scene. It can be like, it can just be something where they want you to talk about themselves. The best way to prepare for them and what I've seen, like the people, when I think about people who have gotten really high scores from me for their multiple mini interviews, they were people who were genuine. I could totally tell they weren't telling me what I wanted to hear, right? Because they shared some things that they were like, well, you normally wouldn't share this as an interview, but this is me. This is me. This is what I've learned from it. And this is how I'm planning to grow, right? So you always want to make sure that you leave room, opportunity, and capacity for growth. Remember, that was the willingness that I talked about. So you want to be yourself, you want to be comfortable. If you're someone who you tend to be a bit more introverted or a bit more shy or a bit more nervous when you have to do interviews, the best way to do it is to have some conversations with people. And you can do this with friends, you can do this with a group of people like, other students, classmates, like pre-med students, where you guys just try to rotate around. And you can definitely practice that on Zoom, or you can kind of rotate around and just kind of find, like, Google different like ethical scenarios, or sometimes they have multiple mini interview example questions that you can find online, and just do some of that. But you don't want it to be rehearsed. You just want to get comfortable having conversations with strangers, right? Is really what you want to do. And people who you wouldn't necessarily sit down and have a formal conversation with, those are the people who always get those are always the people who end up getting the best scores for me. I walk away feeling like, wow, that 7 minutes felt like 1 minute. I could have talked to that person for a half an hour, right? Because you have to remember, they're also looking to see your bedside manner, right? Because when you talk to patients, those are strangers. So how is your bedside manner? Can you strike up a conversation with people? Can you make a person feel comfortable in 7 minutes? Because that's what you have to do as a doctor, right? You only spend, I know my doctor only spent about 9-10 minutes with me, right? But they make me feel super comfortable in that 9-10 minutes. And that's what they want to see if you have that ability to do. So a lot of what they're judging is, like, bedside manner and your mannerisms and the soft skills.
Absolutely. That was a wonderful question or answer. Thank you.
Yeah, great job.
That concludes our presentation with Ms. Shavonia Wynn. We thank you so much for joining us. As I speak for the audience members, we have learned so much from your presentation, and we will use it in our academic careers for the future. So we thank you so much and are so grateful. Feel free, we have several questions remaining in the Q&A. If you are available, if not, no worries. Feel free
Yeah.
to chat them in the Q&A section. There's an option to write a response
Oh,
after
nice. Okay.
your
Yeah,
presentation.
I can stick around and answer as many questions as I can in the Q&A. So I'll do that.
Great. And now we're going to transition into our next presentation. We have about 4 minutes. Thank you, Ms. Wynn, for joining us. We will go ahead and transition. Next up, Magda will be our host, so stay tuned for 4 minutes, please.